Hi, everybody. Dr. Melissa here over at Practice Impact Masters, bringing you one of our Health Masters interviews. And today I'm really excited that we are with JR, the owner of Rejuv Medical. Hey, it's so good to have you here with us, JR.
Thank you so much. I really appreciate allowing me to come talk to your audience and appreciate the great work you're doing for the industry. It's really inspiring.
Oh, thank you. And likewise, we're going to get into some really great things. You guys are going to want to watch and listen to today's episode because you're going to hear how JR grew his medical fitness and just his integrative health and wellness model from 1 to 32 clinics. And then how he took that process and that experience rather to leverage it to help teach other doctors and health and wellness leaders, just like all of you, all of our masters out there, how to really systematize for greater profitability, reach, revenue, income, all those things that we teach you guys about, so that at the end of the day, you truly can have more freedom to do what you love and love what you do, because more and more we're all really feeling bogged down by just the day, right, of running a business and all the many hats that come. So keep listening because we're about to really dive in. So JR, take us back to the day that you went from 1 to 2 to 3. You started that growth. How did you go, how did you make that decision to start to grow? And how did you do it so rapidly? Let's talk about that for a minute.
Well, great. Our first intention was to build our brick and mortar Rejuv Medical. I was a college athlete and I had numerous injuries. And while going through grad school, one of my clients told me to go try Rejuv Medical, which would just open. And there was Dr. Baumgartner. He was kind of a pioneer in prolotherapy. He's written numerous manuals and literature on it. So I went and saw him and he said, JR, you exercise and eat well already, but I'd like to draw your labs just to see if your testosterone, your vitamin D, your thyroid's optimized. And then I'd like to go do PRP, platelet-rich plasma, or stem cells, and I believe we can regenerate the body. And 3 months later, I was completely healed from, I already had 5 knee surgery. I had chronic pain. I would play on the weekends and limp all week long, and I wasn't quite ready to give it up. And when I saw him, he said, JR, he's family practice in sports medicine. He said, I feel like if somebody comes in for diabetes, I'm just covering it up if I give them metformin. If they come in with degenerative disc disease, I feel like I'm just covering it up if I give them a cortisone injection or a steroid injection. You think you could join me and create this vision in healthcare that I see where we could truly regenerate and restore health without drugs or surgery? So I joined him and went to get all the highest level marketing and fitness and business courses possible. And one day, a lady named Susan walked into our clinic. She was on 17 different medications. She already had 7 joint replacements, was very depressed and contemplating suicide when pain was at her worst. And they told her there was no other solutions for her. So she came into our medically supervised weight loss program. And I said, I want you to go see Dr. Baumgartner first. He did PRP. We got her over to physical therapy. We learned some corrective exercises we could do and not do. 3 months later, with our nutrition programs, she was down 50 pounds off all but 2 of our medications. And we realized for the first time, if they came through that 3-step system, just like I had been through, that they start restoring their life with fitness, nutrition, stress reduction, lifestyle medicine components. Then we optimize their internal cell health with functional medicine, IV therapies, nutraceuticals, and we could truly rebuild their body with regenerative orthopedics. And we realized, man, we can do something special here. This is a solution that healthcare needs. And we started and created MedFit at that time, and then we'd scaled it to 32 different locations within 3 years standpoint. We went from a 1,000 square foot clinic to a 28,000 square foot integrated system, where we made a lot of failures along the way, learning how to get these models to communicate and integrate together. And that was kind of the turning point when we seen that we could truly help patients in a capacity we didn't see in general specialties.
I love it. So I'm hearing a couple of different things that I want to just pull out for a moment and drill into a little bit. So first of all, I love you guys are hence Rejuv Medical. Your specialty is regenerative medicine. And I love that you guys really have kind of a 3-pronged process of how to help somebody when they come in, really enhance and optimize their health and their well-being, right? So to really correct existing problems and then how to truly help them heal and thrive. So that's exciting. And you guys grew really rapidly. You made mistakes along the way. You had successes along the way. We have so let me ask you, my wheels are turning because this is a fascinating story and I hadn't heard this part when you and I spoke before. I love that Susan was such the game changer for you guys. She had chronic pain.
The same care, same transformation that we can provide. They're going to go down to their family practice and just going to be on that medication, or they're going to jump right to total knee replacement. And it's really not being able to transfer the feelings that we share about our practitioners' skills and ability to transform lives. If that doesn't show up and there's a gap in there, it's going to be really hard to have the impact or the income that you want.
Yeah, no, valid point for sure. I always tell people, our clients all day long, look, it's really getting the people, the eyeballs to your business isn't the hard part. We think as business owners, I just need more leads. I just need more leads. And the real truth is you've got to have the right internal processes and be able to actually deliver the results, right? Because if you send people to a broken system, then you're going to get bad reviews, you're going to mismatch expectations. It's really going to hurt your brand and your overall long-term success. So you got to get the internal foundation right, internal systems in order, understand those strengths and those weaknesses. And then really from that, as you understand your ideal avatar, your most profitable niches within your business, right? Then you know how to go out and talk, how to market, and how to sell without selling, because you can really highlight those stories. And the best marketing is just truly storytelling. It's sharing, right? Sharing every day in multiple ways.
100%.
I love it. So you're right on point. So what about pillar 4 and 5? Because I know we've only got a few more minutes with you, and you've just been amazing to all of us today. You're sharing so much great insight, and I know you're helping to get the wheels turning in many of our viewers and listeners' heads right now as the actions that they want to take. So what about 4?
Pillar 4 is the medical fitness pillar. So instead of that being the first step in the product that we sold, then when they have their personal skills, they get good, great outcomes, their business works, they know how to drive patients and convert them in the core focus, then we strongly believe it's time to add that differentiator, the major outcome provider, and the integration tool that allows the practitioners, our culture, and our people to be on fire, that every day we have a mission to change lives in our practice.
I love it. Absolutely. I love it. And I think that I'm sure there's variations for different types of providers, but
100%.
I know the medical fitness works fantastically well for any integrative clinic. So if MDs and DOs and DCs and, APRNs, like it really, we actually did that in one of our clinics. It was a fantastic practice model. And yet I know you also mentioned at the beginning within that med fit is also a lot of the lifestyle pieces. So I want to be sure for all of our naturopaths that are listening and our acupuncturists and our chiropractors who don't have any involvement with a medical provider, that this component, this pillar still provides great value as a differentiator. And it's not just about billing the medical companies.
Right.
Here's something different that will really set you apart when you understand this piece and how it can further transform health and lives. So I love that. I just wanted to be clear, because sometimes the term medical for our, certain providers, they may not identify, but I wanted to be clear to explain that.
And I can clarify that a little bit. Some people say, JR, I don't want your size brick and mortar. I don't want more employees. But great, here's what we've done for some of our companies. They come in, and if a patient walks through our doors today, even if they came in for knee pain, we'd say, thank you so much for coming to Rejuv, Mrs. Jones. It's going to be our honor to try to show you everything to do, get you out of pain, back to the lifestyle that you want. Here's access to our Rejuv University that has online meal plans, cookbooks, physician education, and even training resources. So this is our gift. Please share it with your friends and family, as that's what we really believe is going to help you get the best outcome. However, on the backside, if you'd like a little bit more support, customization, and a free medical fitness test drive, here's where you can go meet with our team. So some of our clinics, we allow them to show how to market, to differentiate, to still have an online resource that is completely telemed based or group coaching or recommendation without having the same structure. But it's still that key component. Hand your clients some value and education that does differentiate and allows them to get better outcomes.
I love it. I love it. So exciting. What's that fifth?
The fifth component is integration. So there's many, like well-renowned, like Cleveland Clinic, for instance, they still operate in silos, even though they have very, expertise in the functional department. But same thing with hospital wellness centers. It's about how do we make you have income without your one-on-one time with patients. So how do you have your online supplement, ancillary revenue source? How do you learn how to refer your bread and butter to that advanced care provider that can provide better outcomes? How do you learn how to automate your systems so they do communicate and integrate to the next level of service? We call it the upward spiral. Not everybody comes in on day one and wants to do everything, but you have to have an internal system that shows them, leads them to the next level of success in your practice, that when you go on vacation, you can still earn money, whether that's affiliate income, whether that's secondary programs of supporting other people's products. If you have a list that allows you to gain income, it's still serving your patients on a high level.
I really love that because again, we're kindred spirits, which is why we're doing this interview today, because I've been teaching that same philosophy, although I love that you call it the upward spiral. When we start with the vision and we say, let's reverse engineer, I always say that you want to build the internal systems that are going to drive the ultimate result you want. And so if you want to ultimately scale, and you're starting them here, they're coming in for this problem, and yet you know that if you do this and this and this and this, they're going to get a more comprehensive result. They're going to stay with you longer. They're going to become a really, raving fan. They're going to refer others. You're going to have a great life cycle with that client. We want to always start with that end in mind and be very intentional about how we build the processes. And I love that is exactly what you're saying. And I really love that word, upward spiral. It's very visual. I'm a visual learner, and I'm sure many of our people watching and listening today are. So that makes a lot of sense. And you also said something, JR, that I'm happy to hear. I've done several webinars on this, and I think one of the biggest overlooked opportunities for any of us in the healthcare space, we want to start to scale, and it seems really overwhelming. It can be exciting to go, great, I'm going to come out to a seminar, I'm going to learn more stuff, and then crap, I have to go back and figure out how to implement it. And that's always a point of breakdown. Now, I know you guys have some real solutions to help them easily implement, which you're going to be teaching at the September 15th and 16th weekend. And so sometimes we get into overwhelm and we get into overload. And one of the simplest places we can start is with supplements and having an online mechanism, store, way to sell, because it is residual income. And, and it's just such an easy way to automate, to go into that virtual space, to start scaling into a virtual practice so you don't feel quite as stuck all the time in a brick and mortar. And there's huge opportunities with that. So I'm excited to know that's something you're going to be teaching about that weekend, helping them to get a better understanding about. It's exciting. And of course, we're doing this today because I unfortunately am already booked at another event speaking that weekend, or else I'd be there. And we'd be having a lot of fun together at the event. But you've been so gracious because you're a kindred spirit. I love what you guys are doing. I believe in what you guys are doing. That's why we're doing this interview. And you've made a really great special offer for all of our Impact Masters. Tell us a little bit about what you're allowing me to gift to them for this special event.
Yeah, I had a major injury in a Lyme's flare-up. I pretty much battled that, and I beat it, and I ruptured my Achilles tendon at the end of June. So we've always been keen on getting 150 people here to our events the previous 3 years. So it set me back big time. So our speakers, and we had you, we definitely wanted you here, but you had the other event, which you completely understand, and we definitely want to help and even use your services to take our online platform to another level. So the gracious opportunity is we were giving away 50 seats in general. And so we offered that to yours. I believe there's about 15 spots left of those free tickets. So as a guest and allowing me to come on and to be able to educate your team, our goal is to truly redefine healthcare worldwide with practitioners in a model on a brick and mortar sense for those that are out there. It can be done. We're not the experts in the online space and the telemed world. our goal is to take those practitioners that really want to take and make a successful integrated brick and mortar and really try to help them have the resources and solutions to be able to do so.
I love it. And that's step one, you know, because before we can truly break free from that, we need a viable, great ecosystem that can stand on its own without us fully at every checkpoint. And then we can begin to look in and start with those simple steps, like I said, even with supplement sales, to start to scale. And then it's like, we need to get positive momentum going, right? We need to get a really good, healthy system. And then we go, whew, I've got breathing room. Oh, and now there's extra income coming in over here. Great, that just took a little pressure off. That made it super easy. And so it's this beautiful unfolding process that happens once we get a really healthy brick and mortar. And it opens us up as the business owners to breathe a bit more freely without as much pressure and anxiety and sleepless nights. We get to have confidence that we can take and enjoy some long weekends. So this is the right place. And I cannot thank you enough. I don't know if you guys heard him say, he's gifting y'all some free seats, some free tickets. These are $1,000 tickets, you guys. This is a $1,000 event. $1,000. Your gift for free for taking action and being there. And JR, tell us the dates, tell us the location, and where they can go right now for everybody that's ready to take action, because those are going to get scooped up right away. You've only got about 15 seats left, so where should we send them to sign up?
Yeah, it's go.healthovators/CPSS.SP. So that's Cash Practice Success Summit -SP. And that's where they can go to get the tickets. And there are 3 different tracks. It's September 14th through the 16th. So there's the main stage, which is mainly all business. Great lineup of speakers on that day. And then the second 2 days, we break out in either the functional medicine and the fitness track, the business and marketing track, and then the regenerative orthopedics. So the hands-on cadaver lab, stem cell training.
What?
It's the real deal.
Exciting. Oh my God. And where is it at again?
In St. Cloud at our facility. So you'll get to see how it all combined together. We want people to see how this model works together and functions on the highest level. So I know you wouldn't be disappointed, and we get rave reviews each year. And I just thank you for allowing me to come speak with your network. It's a great honor.
Oh, thank you so much. And listen, gang, I know that was a tough URL, so I'm going to make sure that it is embedded with this playback. And so wherever you're watching or listening to this, the link is right there. So click it, click it, click it before those tickets are gone.
Yep.
$1,000 value. Go ahead.
That link that I'm showing you can go look at the web page, but that would be the $9.99 fee, and that's for you and one other. The doctors, we want you to bring your office manager or your marketing person so they can help you do it. I know as that visionary always come back, it freaks the practice out because here's 17 new ideas. We don't want that for you. So if you email Jenny and H is in Hamilton, at rejuvmedical.com, REJUV medical.com. That's the only way to get the free tickets. The other one where you go register to pay for the full price.
So here's what you're going to do, gang. Thank you for clarifying that. Jenny H, JENNY, H as in happy, at rejuvmedical.com. I will put that in here. Put in the subject line. What do you want them to put in? Just free ticket?
Yeah.
Free ticket. So put in the subject line, free ticket. Let them know that you heard about it here, because those tickets are gone. They're going to be gone. But because you guys are a part of the Impact Masters tribe, you know, they've got their radar out to take care of you guys. And this is just a wonderful gift. So I cannot thank you guys enough for your generosity. The fact that you're truly just opening this up to really share immense value. I mean, nobody gets a free seminar. So, wow, that's an amazing gift. Thank you. We value you. So glad you were with us today, JR. You guys, Jenny H at rejuvmedical.com. She will hook you up, put free ticket in the subject line. It's September 14th. It's right around the corner. So do it now so you guys can like grab that plane ticket, get out there. And we are definitely going to have you back on. You know, I can't wait to hear the follow-up from the event. And let's do something in the future where we dive into some of that regenerative space. I know we've got a lot of listeners that would really love to hear more about the PRP and the stem cells, and there's so much around just even non-opioid alternatives with, you know, pain management, utilizing those therapies. So let's just kind of dangle that carrot for a future interview, and we'd love to have you back on, okay?
Thank you so much, Dr. Melissa. I really appreciate it.
Thanks, JR. Fantastic. Everybody, thanks for tuning in. And until next episode, stay amazing and go make your impact.